Dr. Adaorah, thank you so much. Dr. Olayemi, thank you so much. Please, can you start by just like giving a brief introduction of yourself, what you do, so that we can take it from there.
Okay, good afternoon, everyone. My name is Dr. Olayemi Dawodu. I'm an anatomic and molecular pathologist by specialization. I'm the managing director of a clinical internationally accredited laboratory in Lagos, Nigeria, called Clina-lancet. I am also an educator because I also teach medical students at the College of Medicine.
Oh, okay. Oh, okay, great. Okay, great. Okay, Dr. Adaorah, over to you. Thank you so much, Dr. Olayemi.
All right. Hi, so I'm Adaorah Momodu. I'm a young medical doctor and co-founder and chief operating officer at Oncopadi Digital Clinic. Now, Oncopadi Digital Clinic is a health clinic that is providing access to information and generally healthcare services, and we're decentralizing healthcare services. So that's pretty much what I am.
The introductions. So to all our viewers that have joined, once again, we just want to apologize for starting really late. So our discourse for today is digital health infrastructure, post-COVID-19, new practices and improved approaches for frontline workers, healthcare providers, and patients. And at the end of the session, we hope that we're able to collectively outline how we can build strong and resilient societies during and post-COVID 2019. So I'll direct my first question to Dr. Olayemi. What is the current situation in the healthcare system with regards to COVID-19? If you would like to share your experience on that topic, thank you very much.
Okay, so in my experience working in the healthcare space, there's currently a lot of anxiety and strain on the healthcare sector with the development of the pandemic. And what you find is that you have a lot of physicians that are basically anxious, because of the COVID-19 virus, basically. And so you have a lot of frontliners that are very afraid in terms of engaging with patients. And this has resulted in some organizations closing down. I also think that part of the issue has been the general approach to patients in this dispensation. I think it's usually safer to approach patients as if everyone is infected at every point in time. So in evolving to take care of the current pandemic that we have, we found that healthcare facilities and practitioners have made some availability, some materials just to put some semblance of safety into operation. So you see that a lot of people ask that patients come in with face masks. The staff themselves have masks on. They usually have at the entrance of these establishments infrared thermometers to check for people's temperature, just kind of as a means of triaging. You also have hand sanitizers and also hand washing stations before people gain access into some of the healthcare facilities. In terms of talking about the strain, I think the lack of preparedness has also seen a few of the patients that are infected going to facilities, thereby resulting in the shutdown of some of these facilities as well. And this takes its toll in terms of the resources that they have to continue operations. I must also say that the activity in the healthcare space is a little slower than before the pandemic took place. In terms of patients, in accommodating patients, you also find out that these healthcare facilities have provided things that they have placements on floors to help with social distancing. We also have that in pharmacies as well, to ensure that people are not crowded and just generally to be able to accommodate the people that come into the healthcare facilities at this point in time. Basically, that's the current state that you have.
So thank you very much for sharing. Dr. Adaorah, please, do you mind also talking briefly on the same?
Okay, all right. So to talk about the current situation of healthcare, the healthcare system, COVID-19. Okay, so generally we'll start with, of course, the facilities. So as Dr. Olayemi has said, a lot of facilities actually have resulted, especially in Lagos State, due to exposures. Facilities, the hospitals in question now pose as a source of risk infection, right? There is the fear and, of course, the stigmatization that, hospitals that already have attended to patients with COVID-19 pose a greater risk, and so those facilities have been shut down. And generally, since we know that the pandemic is actually it's actually a respiratory, illness. So we take it that everyone currently now is at risk. You and I seated here, we are all, at risk, and so everyone is a potential, a suspected case until, confirmed. So generally, our health workers, of course, our country was never prepared for a pandemic like this in terms of, human resources that we have, the number of health workers that we have, and of course, even our infrastructure. So we were never prepared for a pandemic like this. And we now have patients, aside from patients, so we have vulnerable patients who have their routine care but cannot access facilities because either facilities are being shut down or generally because the fear and the stigmatization of going to the facility and feeling that, oh, I might get there and get infected there. So patients generally are unable to access the care that they need. Even the vulnerable patients, ranging from cancer patients to our lifestyle patients like hypertensive patients, diabetic patients, they're also unable to access their routine care because these patients normally would go to the hospitals from time to time to access their routine care. So care is limited. Then we have a number of healthcare workers who are now in isolation due to already being exposed to patients. So we are already we had depleted human capital resources, and now those resources are even depleted even further. So generally there is a lot happening in the healthcare space, and we are hopeful that all of this, with everyone's collective effort, will be able to overcome the pandemic. So.
Okay, thank you very much for thank you, Kendi, Adeboyega. We see your comments. So I would not be doing this session alone. With me, I have Adesuwa Ozasuwa. She's the moderator, but she had some network issues. So she would be joining on this session. Also, Dr. Debo is currently not online. He probably might have also encountered technical issues. So we to Adesuwa Ozasuwa, she takes us away from here. Thank you so much for your time. Yeah.
All right. Thank you very much. Can you hear me?
Yes, I can.
Okay. All right. So we talked about the current state in the health. So now, like our topic says, we are more on digital health, and due to the situation on ground in Nigeria now, we have been and all that. And personally, I've seen that a lot of digital platforms have come on board, and like during this period to help people have access to healthcare without even physically going to the hospital. So right now we just want to know, okay, so how has this been? I know for Dr. Adaorah, you are the OO of Oncopadi app. So how has it been like using digital health in this time? How has the experience been and the impact in?
Okay, so I feel that question for me is I would like to share more or less like a personal story on to actually answer that question. So for me, it's a bit more personal right now because I currently have a loved one who is actually affected by the pandemic, COVID-19, still a suspected case. We are not yet sure, but however, we've tried to take him to the physical hospitals whereby he has been rejected, and He's a known hypertensive patient and he's a known diabetic patient. And because there is no actual test that confirms, this suspicion of COVID-19, we've been able to remotely manage and monitor this patient via telemedicine. So telemedicine offers an opportunity to still stay in touch with your patients remotely, go through, their daily medications, see them virtually, and, assess, how they are faring that day. So keeping in touch and then making sure that they are, up to date with their routine care. Telemedicine provides all of that. Another situation would be we had on Oncopadi was a woman with a stage 1 preventable cervical cancer, which if she had not come on board the platform, would probably, if they had waited out through the pandemic, right, it would have probably resulted to an end stage, cervical cancer, and something nobody wants to even, think about right now. So she came on board the platform, presenting with symptoms of, bleeding, post-coital bleeding, and we assess that virtually. And because on the Oncopadi platform, we have access to our specialists, the oncologists, the gynecologists, and we also have access to, our diagnostic partners where we're able to, run investigations. So we were able to connect all of this and our pharmaceuticals. So we're able to, navigate this woman from our house, irrespective of the lockdown, because one of our major challenge was even irrespective of the fact that, yes, the hospitals are, not really accepting patients, especially when it's not even emergency care, in quotes. So one of the major challenge was the lockdown situation, the non-flexibility of, not being mobile, right? So we were able to, organize, an ambulance that picked her up, assessed us in the clinics, and then took her back. She did her investigation. She saw the oncologist on, the platform, and over a duration of 2 weeks, she was able to get the necessary care she needs. And currently now she's undergoing treatment. A greater part of this was done virtually. I'm sure if she had waited out the pandemic, it would have been a totally different story that we would probably have been hearing by the end of, the 4 weeks we've had so far, going into the 5th week right now of the lockdown. So digital health actually has a lot of role to play, especially during this period, as that patients cannot, come into the hospitals. So our physicians really need to be able to assess, and see their patients and still be able to remotely manage their patients in this pandemic.
Okay. Thank you very much, Dr. Adaorah. Okay, moving on to Dr. Dawodu. So from your own end, how has it been with digital health, having to access the test results and all that? So how has it been during this period?
So I'd like to say that even prior to the pandemic, from the inception of the organization Clina-lancet Laboratories, it's always been an integral part of the kind of services that we give to our clients or our patients. And what do I mean by that? Even from the laboratory information system that we use, we have a robust system that ensures that there are no errors in the service that we deliver to our patients. Also, we also have what we call the EMR, which is the medical records, the electronic medical records that we allocate to each patient that comes in. And what this does is that every time, if it's a repeat patient, you have their information, whether they are deteriorating or improving, like a general status where you can always look at the historic background of the test that they've run with you. And this is also a digital, so it's a unique identifier. Apart from that, we have an app in the organization Clina-lancet Laboratories that's called Part Portal. And what this is that it's downloaded onto the device of the medical practitioners for them to be able to access patients' results. So what I mean is, even prior to the pandemic, we already had all these services where it's interactive. Apart from that, we also have the telepathology, I am an anatomic pathologist, and peer review is something that is up there when you're talking about anatomic pathology. They usually say it's dangerous for an anatomic pathologist to practice in isolation. So the organization has always provided a platform where you can interface with colleagues across the African continent in terms of arriving at prompt diagnosis for patients. And then we also have the electronic platform that we use to give results to our patients. So in terms of digital footprint, it's something that we've always imbibed. And like Dr. Momo said earlier, the advent of telemedicine has really gone up. A lot of organizations have now adopted that platform in trying to ensure that they're reaching out to their patients at this point in time. And at this point in time, it also includes them getting their patients to do certain tests and also reviewing results via that medium, and giving prescriptions for patients to go and see their doctors and all that, especially those that have non-communicable diseases different from the COVID-19. So basically, that's the kind of activity that we've had going on around the organization, as well as in dealing with the pandemic.
Okay. All right. Thank you very much. I will do that. For things has been already in place. That's amazing. Okay, so now looking forward, after this COVID-19 pandemic in Nigeria, how sustainable can we keep digital health? Like, there are lots of platforms and a lot of people say, okay, you don't have to get to the hospital, you can just sign in on our platform, we connect you to a doctor, and you'll be able to be reviewed and probably give you ways in which you can get drugs or some stuff like that. So how, like, after all this now, how sustainable will these platforms be, and what can we, or what will we put in place to ensure that these platforms actually don't just go off, like, when everybody returns back to their lives. I can't say normal lives because we don't really know what is going to be normal then. But so how sustainable will they be, and what measures will be put in place or can be put in place to ensure that they are sustainable even after this period?
Okay, so I'd like to say that for us at Oncopadi, we've been in existence since 2018, and telemedicine has been something we've always tried to preach. For me personally, because I know that everyone does not have access to a doctor, so not everyone who is in the and not in the medical space has an access to the medical friend or someone in the medical space. We have a population of almost 200 million people, and we have a population of doctors that are less than 40,000. So to some extent, we know that the doctor-patient ratio is still a bit poor. Well, everyone has access to a phone, right? And everyone has access to a platform that you can get on, and generally, because most times what you find out that a lot of patients that present to the hospitals, when they do eventually, with all of the bureaucracies we have in our healthcare system in Nigeria, is that they would have gone from place to place, tried various methods, tried various things that would have actually put their lives at risk before getting to the hospital. But whereby you have a platform that doesn't really require any form of referral or anything, that actually helps you navigate you to the right place you need to be, I feel like that's really where the future lies. Being able to get the right medical information that you need to make informed decisions at that point in time. So I'll give a personal example. So even though I'm a medical doctor and I have someone who I earlier said is affected by COVID-19, I would tell you that I have been to so many hospitals currently. We've been to 3 hospitals currently. I've even been to LUT, which is my primary primary, home. And I can say that the healthcare system has disappointed me, right? In the sense that we were rejected in all three hospitals. And why? Generally because they were unsure of the patient status and they did not want to treat the patient, even though there were already, existing medical conditions that really needed urgent medical care. So the future of digital health really lies in telemedicine, and it really lies in being able to provide patients with the information that they need. So if I did not have access to a platform where I could, connect with a specialist that could, navigate, I'm pretty sure by now this man I'm talking about would, I can't even imagine the state it would have been in. I mean, with a blood sugar of almost 400, and the patient was literally not making urine. So it's really sad, that the healthcare system does what it does to us. But with telemedicine, even if you do not have access to a friend doctor or you don't even have access to get into the hospital, you have access to something that you could ask, oh, I have this, oh, I have this before it, and you'll be able to be navigated to where you need to get the right care, because it's all about
Thank you, Dr. Adaorah. Thank God for
medical
that
response.
and for the availability of the platform. Because right now, like everybody, even doctors, everybody is scared. There's so much tension everywhere. So having that is good. Okay, so thank you very much, Dr. Adaorah. So Dr. Dawodu, so how so do you think that these digital healthcare platforms that have been set up now are sustainable, and how exactly can we ensure that there's continuity even after this pandemic and all that? Hello? Okay, can you hear me? Hello? You can hear me? Okay. I think it's probably a network problem or something. Adaorah, can you hear me? Okay.
Yes, I can. Dr. Olayemi, we can't hear you. Could you try checking your mic?
Okay, is it better now?
I think we
Yeah,
can. I think there's some form of sound back.
you can't hear her, but I can hear you, Adaorah.
Okay.
Which has gone off. All right, so because I know our time, is fast spent. Okay, so Adaorah, before Dr. Pending when she comes back, so you have shared with us quite a lot. So we know that this COVID-19 has really impacted a lot of people right now, and people have given predictions that after this pandemic, there's going to be a lot of social burnout. Doctors are just going to be, because apart from just Nigeria, in other countries, doctors are working like overtime, trying to, because more than the increase in number of cases. So people are, predicting that there's going to be physician burnout, and also people, normal like citizens, things are not going to be normal actually, because how we used to, stay together in a packed place. So now everybody's going to be more conscious. Everybody wants to be like, oh yeah, let us, even though the pandemic has been said to be over, but things will not remain the same. So what steps will you give people that is living a healthy life even after the pandemic? That is in what suggestions will you give to prevent physician burnout, and also to maintain a healthy life even after this coronavirus?
Okay, so to address the issue of physician burnout, I think pre-pandemic, generally physicians burnout has always been an issue that has been up for deliberation for years now. The level of suicide rates with physicians have been attributed to be more, and even with an increasing number in the younger medical, colleagues, those down, the medical ladder. So I want to say that for us moving forward and living healthy life, I think the first key step will be finding our inner peace, right? I don't know if you can hear me. I
can hear you
an echo. Okay, so finding our inner peace, right? Generally, it will take a while for us to adapt to, things getting normal, whatever the new normal would look like. None of us are sure of, and there is nobody that knows, and there is really no amount of predictions that would, better prepare us for when that time comes. And how do we even know when that time has come? I'm sure it will still take a while for us to, adapt to, touching, hugging ourselves, and even if today, so I did something with a group of friends, and I said, what if today an announcement was made that, you know what, we didn't record any, death, any, positive case today, we didn't record tomorrow, we didn't record like for the next 4 days, and you know what? The world is cleared of COVID-19. You can go out, you can, talk to your friends, you can do all the things, all those things you've always wanted to do. How willing would we be, to go into the okay, Dr. Olayemi is back. So yeah, that's fine. So how willing would we? I think first of all, we have to take things one step at a time. First thing is our personal well-being, right? So currently now, what I would say to people is, prior to when the time of the pandemic comes, let's always try to make sure that we have our regular check-ins with family, with friends. Okay, let's talk more. Let's do more talking. Talk more about the positive things. Talk also about the negative things. Let's try less of criticizing and let's try more of empathizing, right? Let's be in a state whereby we're able to share how we feel. And what I found out is the more you share how you feel, the more you find out that there are people in that similar sphere with you, and that kind of like help the healing process. So when you know that there are people together with you that are sharing the same problems with you, to some extent gives you that necessary joy, what I call it, some form of bonding moment that helps you, move together and helps address the situation. So moving forward after this pandemic, building a healthy society depended on each of us individual effort, right? So what we do individually will determine how the next step would go, or what the next phase of this pandemic would look like for us.
All right. Okay.
Yeah,
so that was
I was actually gonna answer the prior question. Yes, and I was going to say, so when you were talking about sustainability, my approach to it is it's also in line with Dr. Momodu in terms of telemedicine, but in saying that we need to qualify that is a certain social strata of people that can afford data or able to use Wi-Fi and iPad. I also have an approach that looks at aligning with the social developmental goals of universal healthcare coverage. And in looking at it from that perspective, I think what would be sustainable with what we have on ground is also to look at other avenues to use for to promote digital healthcare. For example, the USSD that financial institutions use. Why do I say that? The common market person, the woman who sells pepper, has a mobile phone. It might not be a mobile phone that is Wi-Fi enabled, but they have a mobile phone. And so that's taking away that luxury of having to align with having data or having network. You're able to also reach down to the grassroots. If we can develop modalities, basically, where you can use USSD to also help those who are in need of healthcare at the grassroots level. And also in accessing healthcare providers and all that, even if it's their community health workers, do you understand? Being able to use that platform to reach out to GPs or specialists and all that, and also in advice on the tests that should be done. I think there are also platforms as well where tests can be logged and you don't need Wi-Fi there, but there's a cloud. And you can use those things as well in sustainability to collect data. Data is gold. Data is what you use in planning, infrastructure, policies, processes. It also helps us in localizing geographically where we have certain disease entities, so we know how we intervene. So I think looking at platforms, telemedicine is fantastic as well, but we should also look at it across the spectrum. You know, is my approach, and I think that is more in line with sustainability because of affordability and access across the spectrum.
All right, thank you very much. I think that has been like a major challenge because the whole idea of you don't have a mobile phone that can browse, you can't get money for data, and data is so expensive in Nigeria. So having to have data, having to subscribe daily, having to get a platform, everything can just be a lot of work. But looking at what you said today, I think like that's actually just very, very brilliant. Okay, so our time is fast spent, so we'll be going into questions from our viewers, as participants. I have one question here, so I'm just going to read it out, and then you can just anybody can just take it on. Okay, it says, are there any conscious steps towards making sure that nurses and other health personnel are adjusting and adopting telemedicine during this period? Are there conscious steps that healthcare practitioners are taking to get to the use of telemedicine?
That's all right, you can go. Yeah.
Okay, so for us on our platform, generally we have the simple part of it whereby you can just ask a medical related question, right? And the majority of the people who attend to the questions on the other end are actually nurses, right? That provide the information. And why we are able to use nurses is to attend to these questions is because we understand that most times in our little communities, the nurses, the community health extension workers, the community health workers are really the people that are invested, in the care of patients, of people in the community, as opposed to, specialists and, the general physicians and all. So we've been able to train nurses, and it's really, when you look at it, it's really not so difficult, right, in preparing our nurses, because it's as simple as asking a question and getting a response. The response might not be 100% the way you probably want it, but the idea is that the nurses would serve a very important and vital role in triaging, which is really what is most important. Being able to ask a question, assess that question, and refer you to who or what you need is really what is important. So the onboarding nurses or preparing nurses for this role is really important when it comes to telemedicine.
Yeah, so to reiterate that, I think with the advent of a lot of healthcare facilities, putting up services for telemedicine, I do believe that there must be some orientation or some capacity building of nurses and frontliners before they put out those platforms. So I would say, even though it's not yet a coordinated, concerted effort, sporadically, you see that there are pockets, of empowering this group of the healthcare team in being able to use the telemedicine applications and all that. And I think after this pandemic going forward, there should be more of an effort to address, forums or fora where we can all develop these skills in using this platform in looking after our patients.
All right, thank you very much. I don't think there are any other questions. And looking at the time, I think our time is almost up. So we'll just take maybe any final words from anyone. So that would do Dr. Adaorah. Any final words to people during this period? A lot of anxiety and everything just clouding everybody's mind. So anything that you just like to relate to the participants, people that are listening?
Well, if we're looking at it in terms of the pandemic, I'd say that everybody should, like Dr. Momodu says, stay positive. I believe at this point, I try not to overload myself with the information of the pandemic. So I give myself a window during the day. If it's going to be 10, 15 minutes, I catch up with what I need to catch up and I move on with other things. Like she rightly said, try to stay in touch even though it's remote. And I think more importantly, we should try to ensure that we sustain the gains that we have gotten from this pandemic. And what do I mean by that? The implementation and the healthcare, education that's telling us that we need to maintain good personal hygiene. We have to keep hand washing, whether or not the pandemic is there or not. Personal hygiene, keeping our environment clean, and all the other things basically that we've learned throughout this pandemic, we shouldn't throw away, but we should build on that some more. I also think at this point in time, we need to start looking at how we can harness investment, how we can collectively sit down to look for ways for people to invest in research, in development, which also includes this digital health platform, progress and promotion, basically. I think it's opened up a lot of can of worms, and I think we shouldn't forget so soon, even when this all dies down, that we should keep the tempo sustained to maintain the gains and to improve, upon the practices in the healthcare sector and in the system, basically.
Okay, thank you very much.
Okay, so I like to agree with Dr. Olayemi on this one. Your mental sanity is really most important. Information overload can be something really, in this time, everyone is checking their phones, checking, the news, just wanting to know how many cases have been found, how many deaths have been recorded, how many people have, at this point in time, we need to take a step back and, just allow for your mental sanity. If it is a few hours you give to yourself, maybe to disconnect, to, reflect on even your personal well-being, I think that's very important. I would like to touch more on information. So in as much as there's a lot of information, right? And because there's a lot of information, there is a lot of misinformation. So and the misinformation is really what it's causing a lot of harm. And I think for us at this point in time, we should take it upon ourselves that before I share any information, please, I should take it upon myself to confirm, the credibility of that information, because now you see a lot of information on COVID-19. You some study, you see a lot of information on the use of garlic, for the treatment of COVID-19. We've seen information on the different, therapies that are being working through. I think it's very important because information plays a very vital role in, how people make decisions, and especially when you're in a position whereby your information influences people. I think you should take it upon yourself to always share information that is credible, information that is reliable, because you don't know what that information can do to the next person. Also, lastly, I'd just like to say, in terms of sustainability, health information skill, how can we make sure that to these people? So we have and good. And we've been able to achieve all of this within, a short period of time. So if we can achieve all of this with limited, knowledge of think of what we can do with all of the health information, be able to translate some of our cumbersome health information into little information that the average, human being, or the average Nigerian, or the average Lagosian, in the market, can relate to and be able to use that information to better empower their health.
All right, so thank you very, very much, Dr. Adaorah and Dr. Dawodu. It was nice having you and having this conversation. So I think from everything that we have talked about, we can see that digital health is very important. I know that a lot of people have been running away from it, like X and all that, but it actually has a lot of relevance, and it actually aids access to healthcare even in Nigeria. So thank you very much. We are very grateful. We've come to the end. I think our time is up, yes, for this session. So very happy to have
Thank you.
Thank you.
Thank you very much.
Thank you. Thank you.